and how we need to continue containment of this outbreak. We'll talk about those specific recommendations in a few minutes. We certainly appreciate those words and totally agree with that strategy. Yesterday, Dr. Mark Wilson, who's the health officer for Jefferson County, issued some health orders pertaining to the size of groups that are allowed together, pertaining to what restaurants and bars are allowed to do, and also issued orders related to daycares, private schools, child care facilities, and some other issues. Most of those orders are scheduled to be in place through April 6th. The orders related to bars and restaurants at this time stands for 1 week and then will be reevaluated. What I wanted to announce to you today is that we think that those are excellent orders and are going to mirror those in the counties that surround Jefferson County. For Tuscaloosa, Walker, Blount, St. Clair, and Shelby counties, we're going to be issuing orders that are identical or at least very similar to that. We have spent a lot of time in discussion debating about how we balance the health orders that restricts people's ability to get out and participate in their normal activities of life, but also trying to keep people safe by enforcing this social distancing that'll help us prevent the spread of the epidemic. It's always a decision that's made with pros and cons, and we have to ultimately decide on balance what is best for the overall good of people in Alabama, and I believe this is the right thing for us to do. I want to read you some highlights of the health order, and we'll be able to provide you with a copy of that just shortly. This pertains to Blount, St. Clair, Shelby, Tuscaloosa, and Walker counties. Effective today, March 17th at 5 p.m., all gatherings of 25 persons or more, or gatherings of any size that cannot maintain a consistent 6-foot distance between persons, are prohibited until further notice. This order shall apply to all gatherings, events, or activities that bring 25 or more persons in a single room or single space at the same time. Effective Wednesday, March 18th, 2020, that's tomorrow, March 18th, all senior citizen center gatherings shall be closed. Senior citizen centers and their partners are urged to assure that their clients continue to receive meals and curbside pickup or delivery. Effective at the close of school or business tomorrow, Wednesday, March 18th, there will be closure of all private schools, all grades through 12th grade, as well as preschools and child care centers with 12 or more children. At this time, we are exempting hospitals that have on-site daycare because in an effort to preserve our hospital workforce capacity, that measure may need to be revisited, but at this time we're exempting hospitals from that order for on-site daycares. All of those things that I just mentioned will be in effect through April 6th, so a little less than 3 weeks from now. We will make decisions in the interim whether that needs to be extended or whether we could remove that order at an earlier time. Effective immediately, all nursing homes, long-term care facilities shall prohibit visitation of all visitors and non-essential health care personnel, except for certain compassionate care situations such as end of life or similar events. And then effective today, March 17th at 5 p.m. today, any restaurant, bar, brewery, or priority category 3 food service establishment shall not prevent on-premises consumption of food or drink for 1 week. This order will be reevaluated prior to the end of 1 week for possible modification. We have some additional language that we'll share with you about encouraging them to offer online ordering and curbside pickup, as well as takeout food as well. We are excluding hospital food service areas from this, assuming that they have a social distancing plan that they can implement to make sure that people are in a safe environment. We do have some language that will allow exceptions to this on a case-by-case basis, particularly for certain events. We need, obviously, a lot of lead time and a sound justification to make an exception to that. That's purely at the discretion of the state health officer. Again, that applies to these counties: Blount, St. Clair, Shelby, Tuscaloosa, and Walker counties. I would like to say that I have given very strong consideration to implementing this statewide. I understand that would have tremendous effect on a lot of people, particularly related to things like senior centers and schools and daycares. We have not taken these decisions lightly, and it is certainly possible that the situation may warrant that we implement this statewide. I would like to say today in the strongest possible terms that I encourage everyone in these other counties not affected by this order to go ahead and proceed with attempting to implement these orders. Social distancing is the most important thing that we can do at this time. It is time for Alabamians to hunker down, to isolate themselves, to stay away from other people. It is time to stay out of the public to the extent that you can. And if we are unable to do that by strongly encouraging people to do that, then we would certainly consider issuing a health order to apply statewide. I have a few other items that I wanted to mention to you before we begin taking questions. We do have screening sites, as you know, that we have been in the process of setting up. As of right now, I think there are 6 that are currently up and running. These sites are located in the following counties: Hale County, Montgomery County, Marengo County, Jefferson County, Tuscaloosa County, and Elmore County. The call center number that we have shared with you before has the locations of those. For people who believe that they may need to be tested, they should contact the toll-free hotline number 1-888-264-2256. That number is 1-888-264-2256. And then specific information about how testing can be arranged will be given to those people at that time. We expect to have another 5 or 10 facilities up by the end of the week. The rate limiting step has been being able to obtain supplies like personal protective equipment, swabs for testing, and the like. We have a particular acute issue in our state, as do most states right now, with obtaining specimen swabs. The federal government has sort of taken all orders of those that were to be shipped to states, and states no longer have access to those for a few days, we are told. So we're working very hard with our suppliers and with other states and attempting to relieve that shortage as soon as we can. At the moment, we feel like we do have enough supplies to staff these sites that we have open, and as soon as we obtain additional supplies, then these other sites will be standing up as well. One particular item I wanted to remind people about is related to blood donation. Like oftentimes at different times of the year, we do have a shortage of donated blood. And that's particularly an issue when people are not out and about as much. So while we recognize that all these social distancing techniques are extremely important and need to be implemented, I would say that blood donation would be an acceptable reason to be out and do that. And I would encourage you to do that if you haven't done that. There's really no substitute for donated blood, and we need to continue to support that part of our healthcare response if at all possible. So please remember that. At this time, we have no other infrastructure issues that I'm aware of. Been asked a lot of questions about groceries and food supply. Certainly, grocery store visits would be acceptable. We don't believe there's a need for people to hoard food or to buy large volumes of food. I would say try to minimize your trips out in public as appropriate, but certainly a few days of food at a time, certainly no more than a week of food at a time would be enough. There is no supply chain shortage of food in the United States in grocery stores, except for some things we've seen with paper products. Grocery stores are fully stocked and able to meet the needs of Alabamians. So please remember that, and please try to buy those things in a responsible way. Again, I certainly recognize that people have a lot of anxiety. The situation is changing very quickly, and it seems like we have a little bit different guidance for you every single day. We are staying on top of the best available evidence that we have. We know that Alabamians actually are very resilient and do a great job of getting through tough times. I think we can get through tough times together without any issue, as long as we begin starting now and we begin doing those things that we know are important for us to do. Please remember to check on those people who are the most vulnerable. People who are elderly or have chronic health problems are the people that we want to protect from the virus, and we don't want them to be in large crowds of people. And at the same time, isolation can be difficult for people like that. So reach out to those folks that you know by phone, ideally, and make sure that you're checking on them and make sure that we are taking care of our neighbors. Those are all the prepared remarks I have right now, but I'll be happy to take any questions from you. Lydia.
For the rules enforcements that you guys have put in for Tuscaloosa, Walker, Blunt, St. Clair, Shelby counties, you said you have strongly considered making that statewide. How many cases would Alabama need to have before you guys said, okay, this is what we're going to go for?
Yeah, I don't know of a specific number that would trigger that. I think it would be based on a number of factors. Clearly, the amount of local transmission that we see is a factor. Cases that are imported by travel, for example, are certainly concerning, but would not factor as much in that decision as having lots of local transmission. We understand that there can be a testing bias in Jefferson County because that's where most of the testing is occurring, where most people are able to get access. And yet we also know that the counties that have the most tests other than Jefferson are those that surround that large metro area. Jefferson County is somewhat unique for Alabama. It's a biggest metro area with transportation links and airport and very large universities. And so there are a lot of reasons to think that local transmission is more severe there than perhaps in other parts of the state. But we don't want to see that appear in other parts of the state. As we roll out testing, I think we'll find additional cases. And so even though we have not issued official health orders for the rest of the state, I strongly urge in the strongest possible terms that Alabamians look at these orders and consider implementing those in the counties that aren't covered by this health order.
You would say, with there being more cases obviously reported right now in Jefferson County, that is primarily due to testing bias and there being more tests available there, not necessarily because the outbreak is more concerning there? Yeah,
I would say we don't know for certain. I think clearly it's reasonable to assume that we're picking up cases in the places where we're testing the most. But at the same time, because of those factors I just mentioned that are somewhat unique to Jefferson County, there certainly may be more local transmission there. I don't know that for certain right now.
Been tested in Alabama so far?
I don't know that number. We have some numbers that I don't think I have for you about what our state lab is doing, but the drive-through sites are testing hundreds and hundreds of people a day. We're now standing up these additional screening sites in these 6 counties that I mentioned. So I don't know, hundreds or maybe higher per day.
These are some pretty drastic measures that the state is taking. Does this mean we're nowhere near of containing this or stopping the spread?
Yeah, I think our strategy has always been one of prevention and surveillance and monitoring, as we knew about people who were traveling to Alabama. And then containment is really the idea of we found a case and we're trying to shut down contacts around that case. But I think we're moving more beyond that to a strategy of what we would call mitigation. And what we mean by mitigation honestly means asking people to social distance and requiring it in some cases. Mitigation essentially is the 6-foot rule. And when you hear people use that term about mitigation, what we mean is stay 6 feet away from other people. And so that's really the most important message that we want to get out now. We can get through this, and we will get through this in a few short weeks, but we do need to start now, and we do need to take seriously these recommendations.
What about dentists, eye doctors? What's your recommendation for that?
Yeah, we have actually gotten all the available guidance that we can find about that, and we even have, for example, our dental unit is working on additional guidance for dentists right now. I would say this is a reasonable time for people to consider postponing things that might be considered elective, whether that's medical procedures, for example, or hospital procedures, but also other types of health procedures. I had that discussion with my own parents this week about visits that would be considered optional for them, and so I think that's a conversation that a person would want to have with their own dentist or their own optometrist or their own provider. But for people who are medically vulnerable, like the elderly or people with chronic health problems, they need to minimize their contact outside of their own homes in any way they possibly can.
Have we seen any students at any universities with this, or any professors?
I don't know the answer to that. I don't remember. We're as I told you, I think we're over 30-something cases, and I'm just not sure about that. I don't know.
Could you repeat again the number of cases? I know earlier you said, I believe, you said it was over 36?
36 was the latest number I have from this morning, and about 20 of those were in Jefferson County.
And we've heard different recommendations. I know you said 50 or more 50 more people in a gathering. We've heard 25, 10. Is this more so a number, or is it just that 6-foot distance that you guys are encouraging?
Yeah, that's really a great question. I'm sure you're aware that the president yesterday said 10 people in a gathering. Many jurisdictions have said 25, and some still say 250. And it's absolutely not about the absolute number. the most important factor is being able to maintain that 6-foot distance. So in this health order that we've issued for these counties, we've said 25 people, but obviously, 24 and 26 aren't that different. What matters is that people are able to maintain adequate distance.
Any updates on the conditions of some of these confirmed cases? Are they still being treated in hospitals? Are many of them out of the hospital, self-quarantine?
I do not know that information. Our staff is monitoring those individuals, but I don't know that.
How long are you hearing that this could last? The president yesterday said it could go into the summer.
I think we don't know. The information that we have to base our ideas on is from what we've seen in other parts of the world. We see what's happened in China. Their cases probably started in at least early December, but maybe even in November. And then by early March, they had certainly seen a significant improvement, although that was with some really stringent measures, to keep people from traveling and to keep people in an isolation situation. South Korea also has had a real robust response, and their numbers have not, as many as they've had, their numbers have not been as high as perhaps people were anticipating earlier. So I think with respiratory infections, a 3 or 4 month course is a reasonable place to start guessing how long it's going to last. But we certainly hope that with these mitigation strategies, it won't last that long, but it's just unknown because it's a new virus.
An earlier press conference, you mentioned feeling like, you guys have been prepared for this. Is something that, even though Alabama, one of the last states to have some confirmed cases, how do you feel about your response so far? And kind of, you mentioned that maybe having some hesitation, getting some tests and that kind of thing. How do you think that compares to some other states?
I think we're having similar issues that a lot of states have had. I think if we had widely available testing everywhere, we would have certainly tried to implement that earlier if we could have done that. We, in fact, set up our testing at the earliest possible moment that we had the ability to do that. Time will tell, whether these decisions are right or wrong. It's challenging because if we get through this and we have no cases at all, certainly people will say that must have been an overreaction. And if we get through this and have lots of cases, people will say it was an adequate response. So I think that the situation changes very quickly. We're making the decisions that we can with the very best information that we have. And we feel like we have a good plan in place to help mitigate this. But situations are changing quickly.
Could you speak again to how this is spread? I mean, you have people that are afraid to sit next to their coworkers, touch doorknobs, elevators. Can you talk again on how this is spread among people?
Sure. So it is spread from person to person, but can be spread through contact with a surface. And so a doorknob or an elevator is certainly one possibility. We have been preaching social distancing, and I don't want to forget to mention that environmental hygiene is also very important. Make sure to clean those surfaces that are being touched often by other people. Again, try to stay away from places where other people are. But it certainly can be contracted through being near someone who's coughing or who has secretions, but can be acquired through the environment as well. We don't have lots of evidence that the community as a whole is at risk for people. Just being out in public, generally speaking, to go to the grocery store or to go to the drugstore doesn't seem to be a high risk for infection. But use common sense about that. Practice good hygiene. Make sure to wash your hands. Avoid touching your face. And by all means, please stay home if you're sick. If you do have symptoms, please stay home if you're sick. Pick up the phone. Call your healthcare provider. But don't go out in public and put other people at risk. Okay. All right. Any additional questions?
Dr. Harris, we have questions on our Facebook Live feed. People are asking about beaches, mostly people from out of town that are coming and arriving this weekend, and they want to know what to do.
Sure. So I would ask everyone to use prudence when they're traveling on vacation. A beach vacation, for example, you can certainly imagine that there may be a way to maintain social distancing in that environment. I would certainly encourage people to be careful about gathering for meals, and we would suggest to them that they follow consistently the rules that we put out today. I don't think the beach itself or the ocean itself is any particular risk at all. But what's really important is to maintain this 6-foot distance between people and try to continue those same social isolation techniques.
Dr. Harris, what would you urge people to do about nail salons, hair salons, barber shops, that sort of thing?
Yeah, we've developed guidance, and we're working with the folks in those businesses to try to get them the best information. At this time, those things that are considered elective, I think people should consider delaying those for now. When you're in an environment where you're very close to other people, there's some risk for disease transmission. And so for those who are most vulnerable, the elderly and those with chronic health problems, by all means, they need to try to delay those if they can do that. I do want to remind you, everyone in the state has the ability to keep yourself safe and keep your family safe. It's fairly straightforward and fairly simple. Just remember to practice these social distancing methods that we've talked about. Please stay home if you're sick. Please be prepared for some inconveniences and some changes in the way you live your life for a few weeks. But I know working together we can get through this. Thank you very much for joining us.
Dan Petrelli. Cool.
When would you leave to go to